Hello everyone, I'm Dr. Lim Chin Tat. I'm a private orthopaedic surgeon as well as the medical director for the orthopaedic practice and surgery. Thank you once again for tuning into this channel. Today, I'm going to share with you some interesting facts about knee pain. Knee pain is really common. I've seen both the younger population as well as the elderly complaining of knee pain. In the younger population, they tend to get knee pain from sports injury or from excessive usage leading to wear and tear. In the elderly, they tend to get knee pain from degeneration. They tend to get wear and tear over many years. I've gathered some information from all the common questions that patients tend to ask me when they consult me. So I thought that it would be a good way to share this information with everyone. So the number one questions the patient asks me is, what are the causes of knee pain? Knee pain are normally due to damages inside the knee. So patients can get knee pain from cartilage wear and tear. So the cartilage is the smooth lining of the bone in the joint, so that allows the knee or all the joints to move with minimal friction and minimal pain. So patients can get knee pain from cartilage wear and tear. Patients can also get knee pain from ligament injuries. So ligament are strong rubbery structures that provide stability between bones so that the joint doesn't glide so much when they move. So patients can get knee pain when they have a ligament injuries. Specifically for the knee, patients can get also knee pain when they get meniscus injury. Meniscus is an elastic tissue between the two bones that absorb the stress every time we walk. So we can get knee pain when we get a meniscus injury. But knee pain is more complex than that. Knee pain may not even be due to damages in the knee. So the knee pain may not originate from the knee. So there's a form of pain which we call referred pain. So patient can get knee pain when they have nerve impingement from the lower back. Patient can also get knee pain when they have inflammation or injuries to the hip because they share some nerves. Next common question is, when should I worry about knee pain? As I mentioned before, knee pain is really common. So it will be impractical for me to advise every patient to seek medical consult for all their knee pains. I'll be happy to see all of you, but I think that will be an unreasonable advice. So many times, when we have knee pain, we will self-medicate, we will rest, we will ice it, and most of the pain will go away. But if the knee pain is associated with symptoms such as clicking, such as locking, such as swelling, then I think one should seek medical attention as soon as possible. So the clicking sensation is a feeling in the knee when you move, and the feeling is such that it's like umbrella clicking open and close. So you feel a click when you straighten and bend the knee. The locking sensation is when your knee gets jammed in a particular angle and you have difficulty maneuvering out to a fully straightened position. And swelling, of course, is when you cannot see the contour of the knee well. It swell up like a balloon, and that will be really quite serious. And I think with these symptoms, one should seek medical attention as soon as possible. There are also some other red flags that points to a more serious or more cynical cause, such as a fever, such as warmth, such as a loss of appetite, loss of weight, and this will point to causes such as tumor or infection. And with these red flags, I would suggest one seek medical attention faster. Another common question is, what can a doctor do to tell me more about the knee pain? I mean, for me, when I see the patient, I like to take a very detailed history. I would like to ask the story, the history of the pain, and then I will examine the patient thoroughly before going to investigation. Some part of the history, the story that's important, includes the type of pain. I want to know whether the pain is triggered when you walk, when you climb stairs, because this kind of pain, in medical terms, we call it mechanical pain. So this type of pain, where it's aggravated by walking or stepping, indicates more of a structural cause of the pain. That means some of the tissues are damaged. But another type of pain, which is called rest pain, points towards more of an inflammatory pain. So patients get this kind of pain even when they are seated down. When they are watching TV, they get this nagging, bothersome knee pain. And this points towards more of a inflammatory pain, such as a rheumatoid arthritis or gout. Another question I tend to ask, where is the pain? For example, if the pain is around the front of the knee, it can indicate quadriceps tendonitis, inflammation of the quadriceps tendon. It can be due to kneecap wear and tear, or it can be due to patellar tendon inflammation. If the knee pain is more on the outside of the knee, it can point towards the cartilage wear and tear or meniscus injury, like we mentioned previously. If the knee pain is on the other side of the knee, it can point towards the cartilage wear and tear or the other meniscus tear. So the location of the pain, the site of the pain, is useful in guiding us towards a diagnosis. Other part of the story that's important example, pain on stairs climbing will indicate damage over the kneecap, and pain on flat ground will indicate damage over the meniscus or other parts of the knee. Some patients also ask, what should I do when I get knee pain? Do I seek, especially if I don't seek medical attention immediately, what should I do? So I think the first step to do is to stop all the activities that trigger the pain and all strenuous lower limb activity. I think pain is the best of warning symptoms to tell you to stop and rest so that you can recover for more activities later. So I would suggest that rest, okay, avoiding all the triggers. And then of course we always advocate RICE, rise, rest, icing, compression and some elevation. And most of the patients will also take some over-the-counter painkiller to try to elevate the pain. And if it doesn't go away after a few days or few weeks, I would suggest seeking medical attention. And if you do have other symptoms such as clicking, locking, swelling, or the reflex symptoms such as fever, rest pain, loss of weight loss, or appetite with the pain, then I think one should seek medical attention. Many of my patients will ask, what can a doctor do? Like I said before, I will take a detailed history. I'll examine the patient to make sure that the knee pain is really indeed the cause of the knee pain, and making sure that the pain is not referred from other areas such as the back or the hip. Usually I may take x-rays to find out more. So x-ray will be able to visualize the bone really well and visualize a very advanced joint degeneration. Sometimes if necessary, I will go on to order a magnetic resonance imaging of the knee, MRI of the knee. So MRI is a radiation-free imaging tool where we can see the knee in detail. We can see the cartilage, which is the lining of the knee. We can see the meniscus, which is the cushion between the two bones. We can see the ligaments, which is the rubbery, strong structures that holds the knees together. With a good history, with a detailed physical examination as well as the appropriate imaging, I will be able to come up with a diagnosis and start treatment. I think we have enough information about knee pain. In the next video, I'll go through some of the topics in detail. I will go through a ligament injury in detail, meniscus injury, cartilage wear and tear. In the meantime, I hope everyone has learned something from this video. If you have any queries or comments, please do feel free to write them in the comment below. If you have more topics that you want to know about, also feel free to write them in the comments below. If you like this video, do remember to click like. If you want more information, do remember to subscribe to the channel. If you want more information, you can also come to my website www.tops.com.sg. Thank you everybody for the time and attention. I'll see you again soon. Bye.